suicide headaches. Does headache make a person suicide? Hi, my name is Dr. Pravin Thomas. I'm a consultant and clinical lead of headache and interventional headache neurology services at Narayana Health City, Bangalore. A very common condition that we often hear about is migraine. Migraines can be associated with significant depression, which may be one of the contributing factors for someone to end their life. This is quite sad because migraine is a disorder which can be treated well with these comorbid depression and anxiety. However, there is a rarer condition, a condition which can be so severe that people even kill themselves because they cannot bear the pain. Those headaches come under the category of what is called trigeminal autonomic cephalgias. The most popular or the commoner ones which people have heard is cluster headache, also known as suicide headaches. Now, there is some very interesting feature of this entire group of trigeminal autonomic cephalgias that helps us to differentiate from the other common varieties such as migraine. They're short lasting. They can last for a few seconds or few minutes, but certainly not more than many hours. These conditions can also present with several hours or days of pain, what we call as status. That's different. But traditionally or typically, each attack will last for only a few seconds or minutes or maybe a few hours. Now, the treatments of these conditions are different. And it's also important to understand that it's not just one single condition. There are various types even within the trigeminal autonomic cephalgias, such as sunct, suna, paroxysmal hemicrania, hemicrania continua. But another striking feature of these conditions is that there is a lot of the autonomic processes involved, as a result of which the manifestations could be a redness of the eye, watering from the eye, watering from the nostril, and they are mostly one-sided. They're unilateral, which is just one side of the head. Very rarely they can affect both the sides, but generally speaking, they are short-lasting, limited to one side, and prominently causing the symptoms like watering from the nose and the eyes, and redness, puffiness of the eyes. The pupil of the eye may appear smaller, the lids would be kind of puffy, and you may think that there is something going on with the eye or the nose, but the problem is predominantly because of the areas of the brain which control the autonomic nervous system being affected. Cluster headache again can be due to many causes. Sometimes you don't identify any cause, but sometimes if you were to look into the various causes, you may find some tumors, some vascular problems that is related to blood vessels in the brain, which may be the cause of the cluster attack. So each attack is called as a cluster attack. So it can cluster. The reason it's called cluster is because they tend to cluster in a particular day or in a particular season. So the treatments also vary from whether you're dealing with a pure cluster headache or is it because of another condition which manifests as a cluster headache, in which case you need to treat that condition also. For example, if it's a tumor that needs to be treated. And sometimes it's associated with hypnic headaches, which means headaches which happen when someone's sleeping. And during the sleeps, people can just suddenly get up with these severe headaches. So it's important to understand this rarer form of headache, but considering the fact that a large majority of the world's population is affected, that you still have thousands of people affected and not knowing what to do because most of them get misdiagnosed as another condition. There was one study which showed that it takes approximately 8 years for these patients to actually get diagnosed as having a trigeminal autonomic cephalgia. So that's very important for people, doctors, treating clinicians, everyone to know about this condition so that they're diagnosed earlier and therefore treatments initiated earlier, interventions done so that people don't have to take the step of no return. So therefore, I urge all of you, ladies and gentlemen, to understand more about these conditions and to meet your doctor if you have any of these symptoms. Thank you.